Are you eligible for a new subsidy through Covered California? Let's find out. Hi, I'm Kevin Knaus with InsureMeKevin.com. And if you have not heard the news, the Biden-Harris American Rescue Plan made some changes to the health insurance subsidies through the Affordable Care Act. Specifically, for income earners over 400% of the federal poverty line, there will now be subsidies for up to 8.5% of your household income. And this is significant because there was a 400% cliff. So if you made $1 over 400%, there were no subsidies for you. And that federal poverty level is based on household size and income. And if you were $1 over, you had to pay all the subsidies back to the IRS. Covered California is going to be releasing information on how all this is going to be processed in the Covered California application. Right now, we're in towards the end of March, and this is going to be happening in April. But you can see from their graph that yellow line is the older Affordable Care Act subsidies, and they stopped at 400%. California had offered subsidies up to 600%, but the new subsidies from the American Rescue Plan will go up, past 600% and cap the percentage that a household must pay at 8.5%. But there's some caveats to all of that. So let's kind of get into them. First, the second lowest cost silver plan. The Affordable Care Act revolves around making the second lowest cost silver plan in your area affordable. So if the second lowest cost silver plan is above the household percentage contribution, and it might be as low as 2 or 3%, then the subsidy makes up the difference to bring it down to that particular percentage. Now, California has 19 different rating regions, and there are rates that are all different for the second lowest cost silver plan in all of those regions. Some of the regions only have 2 silver plans. Now, it doesn't make a difference what plan you spend this subsidy on, whether you get a less expensive bronze plan or a gold plan or a platinum plan. The subsidy is based on making that second lowest cost silver plan affordable. And when Covered California does it, they do it by looking at the annual premium cost for the overall health insurance and comparing it to your annual modified adjusted gross income. So those are the 2 acronyms that you'll see on these charts: MAGI, modified adjusted gross income, and SLCSP, second lowest cost silver plan. So if we look at the subsidy for a 40-year-old individual in Sacramento County, now, there were no subsidies for an individual making over $51,040. There were no federal subsidies. But now there are, based on that second lowest cost silver plan. And from this chart, you can see as the income goes up, the subsidy goes down, because as the income goes up, that set price of the second lowest cost silver plan becomes a smaller and smaller percentage of the overall annual household income, to a point at right around $60,000 that in Sacramento County for that 40-year-old, that is the cutoff point. So if this individual makes $70,000, they will not get any subsidy, but below that, they do. So let's look at another scenario. 2 adults, they're each 55 years old, living in Los Angeles, California. The second lowest cost silver plan for 2 adults, 55 years old, is $14,743. That is the annual premium amount. Now, for a household of 2, there were no federal subsidies over about $105,000. And at that rate, you can see that $14,743 was, 14% of about $105,000. Now, this couple will be able to get a subsidy to bring that, if they enrolled in the second lowest cost silver plan, down to 8.5% of their household income. So as you can see, as the income increases, the subsidy decreases. because the $14,743 is becoming a smaller and smaller portion of their household income. And then when it gets to less than 8.5% of their household income, right up there about $174,000, then there is no subsidy. But the subsidy zone for the 8.5% is from that point where the annual cost of the second lowest cost silver plan equals 8.5% of the household income. Now, like I mentioned earlier, the rates are different throughout California. And in Northern California, they're quite a bit more expensive. So if that couple moved to San Francisco, the second lowest cost silver plan for those people would be $23,897 for the year. But now, under the American Rescue Plan, they get a subsidy to bring down the cost of their health insurance, and they can make a lot more money and still get a subsidy because obviously the cost of the health insurance is more expensive. So that $23,897 hits 8.5% of the household income at $280,000 annually. So they'll be able to get a subsidy and still make more money. But of course, you have to be in a higher cost zone, like San Francisco, the Bay Area. Region 1, the Northern California counties are very expensive, and so is Monterey. So it's expensive up in Northern California, at least for health insurance. Now, another way to look at how all of these subsidies work is going back to that single adult, age 40, Sacramento County, and looking at the cost of the second lowest cost silver plan. And this is interesting because the silver plans on Covered California are artificially inflated by 10 to 15%. Now, that's another discussion, but they are. You can get virtually the exact same plan off exchange, direct from the carrier of your choice, Kaiser, Blue Shield, Health Net, whoever happens to be operating it, and they will be 10 to 15% less expensive. So if you have a silver plan off exchange, you need to receive a subsidy that lowers the cost of the Covered California silver plan below what you're already paying. Because we have to remember, the only way you can get the subsidy is to enroll in Covered California and buy that plan. So now maybe you have a bronze plan and that's okay, but if you have a silver plan, it's going to be higher on Covered California. The bronze, the gold, and the platinum plans are the same rates on or off exchange. It's just that silver plan that has the artificial surcharge onto it, making it more expensive. So that's kind of one thing you have to think of. A couple other things that you should consider before making the switch to Covered California is if that silver plan is a lot lower, then maybe it isn't a good deal to switch. There are other plans off exchange, particularly grandfathered plans that you may have purchased before 2014 that have a very good rate, although they may not have the same benefits, and that may not be worth giving up because usually once you give up that grandfather plan, you can't get back into it. Another issue to consider is if you've already met your deductible with your off exchange plan, if you have met your maximum out of pocket, then you may not want to change. Once you've met your maximum out of pocket for your health plan, generally the health plan covers all of the costs in network for the rest of the year. And once you switch to a new plan, everything resets to zero, deductible, maximum out of pocket. So that can be very tricky because then you could lose a lot and end up paying a lot more, even if you are paying less in the premiums because of the subsidy. You may have to move through that deductible all over again. And then there's also the COBRA, which I believe, I haven't read everything, but it sounds like some COBRA people will have their premiums paid for through September of 2021. So if that's happening, you're not having to make any health insurance premium payments, you may not want to switch. And some COBRA plans and off-exchange health insurance plans in the individual and family market have doctors that you can't get in the covered California plans. And I'm thinking specifically of like Stanford hospitals and doctors are not at any covered California plan. They're offered in the Health Net full network PPO. So there's some other things like that to consider. Overall, it could be a really, really good deal. So you kind of really need to sit down and kind of crunch the numbers and see if it makes economic sense. Understanding all of the different situations with the second lowest cost silver plan and how that subsidy is figured and how it decreases with your income going up. There's a lot to think about. If you have comments, questions, you can leave them below. Go to my website. You can shoot me an email. I'll try and answer them, or you can call me on the phone. I actually answer that from time to time. All right. Enjoy the spring and subsidies through Covered California. For InsureMeKevin.com, I'm Kevin Knaus.